Okay, we are live now. Just wait for a few seconds for people to join in. Uh, Okay, I think we can start now, Doctor. Yeah. Okay. Good afternoon, ladies and gentlemen. Welcome. I am Akma from the Sales, Marketing and Public Relations Department, Hospital Fatimah Ipoh, and I'm pleased to announce to you that in conjunction with World Breast Cancer Awareness Month in October this year, with the theme "Together All Our Actions Matter," that we are very pleased to have with us today Dr. Sakunan Mak, our resident consultant, general and bariatric surgeon who will deliver a talk on this awareness. Dr. Sakunan Mak is graduated from Manipal Academy of Higher Learning in year 2004 and then obtained his master's in surgery from the University of Science Malaysia. He then completed his training in laparoscopy with a diploma from Strasbourg. With interest in bariatric and metabolic surgery, he further pursued a fellowship program in bariatric and metabolic surgery in King Chulalongkorn Medical University, Bangkok. He is currently a general and bariatric surgeon in Hospital Fatimah Ipoh and an adjunct lecturer in surgery for University Kuala Lumpur Royal College of Medicine, Perak. Besides minimal access surgery, he also has keen interest in clinical nutrition. He is currently the chairman of the Malaysian Medical Association Perak branch, the secretary of the Malaysian Hernia Society, and committee member of the Society of Endoscopic and Laparoscopic Society of Malaysia. Therefore, it is our privilege to have Dr. Sakunan Mak, who will share with us his immense expertise and experience in his talk entitled "The Fight Begins with Awareness." This talk is about 45 minutes and we will have another 50 minutes in our Q&A session immediately after the talk. So it is my pleasure now to introduce to you Dr. Sakunan Mak.
Okay, thank you so much, Ms. Akma, and on behalf of the business development team, I want to say thank you for putting up this program with regards to breast cancer. Right, so welcome everyone this afternoon. It's a bit of a cold and a gloomy afternoon today. I hope you're all comfortable. You've got your lunch there with you, and I'll try to make this as simple and as interesting as possible. All right. So as you all know, this month, October, is Breast Cancer Awareness Month. So we try to do activities, awareness programs with regards to breast cancer. And you can see I'm wearing my as close as possible pink shirt that I have today. So I hope you all have done your part to fight this whole thing against breast cancer. All right, so let's move on. Okay, when we talk about the breast, okay, first thing, we got to know that it is an organ which is only specific to mammals, all right? And then we humans do have this organ called breast, and it's organ specific for females. Basically, it's well developed in females and males. So when some people would like to ask, okay, what about males? Do we have breasts? Yes, we do have breasts, but it is underdeveloped, okay? And the main function of this breast as an organ is for lactation, all right? So we'll look into a little deeper as we go. All right, so the breast is situated in the anterior aspect of your body. Anterior means it's in front, so it's situated in front, and then it is connected, okay, through various lobules as well as lymph nodes. We'll go into a detail as we go along, okay, not to worry. All right, so this is how the side view of the breast looks like. Okay, you can see there's some fat tissue and some muscles and some ribs. So almost everyone, okay, when you look at it, irrespective of their age and their size, the breast will commonly situated in front of the second and the sixth ribs. Okay, it is situated in that area. Next thing you will notice that they will have some adipose tissue, which means fat. There are many misconceptions thinking that the entire breast consists of fat tissue, but that's not true actually. So the fat tissue is just the surrounding tissue which encompasses the breast, okay? But majority of it is mainly in these lobules. So like I mentioned, the breast is a main organ for production of milk for lactation, for breastfeeding. So what happens is these lobules, you can see there in the blue, what happens, milk is produced over there. All right. So during lactation, after pregnancy, after delivery and lactation, so these lobules become bigger and become more active. So they start producing milk. All right. So once the milk is produced there, it moves into the ducts from the back and it moves into those small ducts you can see there. So these ducts are like channels basically. So the milk will move into there and move up right up to the nipple area. And this is where the milk is ejected out during breastfeeding. So when we talk about breast cancer, if you can see that outline which I've done, breast cancer usually occurs in those particular little subunits, which are the lobules, the ducts, and all that. So this is where the main problem of breast cancer arises from. All right, so before we look into breast cancer proper, let me just bring you through the statistics of breast cancer. So this is our geography, this is our Malaysian statistics. As you know, as of this 2020, this is our current population, about 32,300,000 plus. All right, and next, look at this pie chart. Don't be too worried about it. So this pie chart, what it's trying to show you is in the whole of 2020, and all the ladies, what they have done is they took all the cases of new cancer cases. So you can see there they have other cancers, which means all the other cancers, stomach cancer, bone cancer, and things like that. They've grouped it up into one. And then you can see uterine cancers, cervix cancers, ovarian cancers, and colorectal cancers. And unfortunately, breast cancer seems to be the biggest, it takes the biggest chunk of it. Close to 8,500 patients of new cases were diagnosed in 2020. So that's nearly 32%. Okay, so ladies and gentlemen, if you look at it, it is in fact a very big number. So that is why statistics is important for us, because we need to know how much are we doing enough, or people are not coming forward, when they have early breast cancers or early tumors. So important to know. Another alarming problem which we see is it's now in year 2020, we have social media, we have lots of talks going on, and despite all these attempts made to bring the message across, okay, we still find a very high alarming rate of breast cancer. So this goes to show that we still have a long way to go to fight breast cancer, and I'm sure we can do it with the proper adequate channels. Okay, this is another summary of statistics. Don't be too worried. I'll just summarize and make it easier. As you look down there in the red highlighted area, among females, you can see that the top 5 most frequent cancers are breast cancer, colorectal cancers, ovarian cancers, and uterine cancers. And when we combine these two, basically bila kita make an average, kita puratakan, okay, kita samakan the numbers among male and female, we find that females' breast cancer is still very, very high. All right, so this definitely needs to be done. We need to do a lot of work into it, and hopefully through awareness program like this, which is done regularly, we can bring the numbers down. All right, so this is a chart showing you, this is a worldwide chart, which means they look at the incidence, basically how easy is someone able to get these breast cancers. So you can see males in the blue and the females in the purple. All right, so when we look at it, that means for every 100,000 people, there are close to 50 females who are getting breast cancer. Okay, so this is also once again pretty high rate, and no doubt is worldwide, but still, it needs to be taken into account seriously. Okay, this, when we look at it, is the incidence, which means how easy for someone to get breast cancer, and the one in blue is talking about the mortality. Mortality rate means the death rate. That means how frequent do people die from breast cancer. So once again, breast cancer seem to be topping the charts. When you look at it through colorectal, lung, and other cancers, you still find that many more people are getting breast cancer, close to 50 per 100,000, and mortality 20 per 100,000. So still, when you compare with the other statistics in there, it's still pretty high. Okay, this is another chart showing you the past, present, and future. So this was taken in 2018, and what they did is they compare between breast cancer and lung cancer. So kalau kita tengok belah kiri breast cancer, belah kanan lung cancer. And carta warna orange itu ialah 2012, carta warna biru 2012, and carta yang stripes ialah kita project, kita jangkakan pada tahun 2040 bagaimana kes breast cancer and lung cancer. So you see, in the past, okay, lung cancer used to be the major cancers, right? Then over the years, it has slowly come down, probably because detection rate or probably because awareness is slowly starting to come down. But if you look at it here, 2012 for breast cancer is a surplus lung cancer in the same year. 2012 pun sudah meningkat, dan bila kita tengok untuk 2040 yang dijangkakan, nearly 2 kali ganda untuk 2018. So this is quite alarming, quite worrying, and something we need to do something very seriously about. Okay, so itu when we look at it through the world. So what about us here in Malaysia? Okay, so this study was done in 2005, and they found that the Chinese population had a higher risk of developing breast cancer, followed by Indians and Malay. So kalau ikut carta ni, 60 rakyat Cina over 100,000 ada lebih chance untuk dapat kanser payudara jika dibandingkan dengan kaum India dan kaum Melayu. So to simplify this is how it looks like lah. So every 1 in 16 Chinese persons may develop the risk of getting breast cancer. Indians 1 into 17, dan kaum Melayu paling rendah 1 into 28. Alright. Kalau what about us here in Perak? Ini statistik saya dapatkan untuk tahun 2014. I don't have the latest one, but untuk 2014, this carta menunjukkan kanser untuk semua kaum lelaki dan kaum wanita, and then still bila dikombinkan sekali, kaum wanita is still the highest for breast cancer at 17.1, and for females, you notice breast cancer is way higher compared to the other cancers, colorectal, uterus cancer, lung cancer, nearly triple the amount of what of the other cancers, and this is in 2014, and we expect it to be higher in these few years. What about the age? Okay, so when we do a statistical analysis, we find that the common age in which the person develops breast cancer is around 50.6. So basically, between 50 to 51 years of age, you are at the risk of developing cancer. So, but that doesn't mean you need to start only going for your screening or checkup only at the age of 50, but we always encourage you to start as early as possible. So current guidelines will tell you to start as early as 35 years of age. As you know, kes-kes cancer sekarang semakin banyak, dan umur pesakit yang dapat kanser semakin muda. So we really advise you all to start screening and start examining yourself at a very young age of 30 to 35. Alright, so now looking into the diseases of the breast. So secara ringkas, and an easy way and a simple way of doing it is you divide it into benign. Benign means it is non-cancerous, and malignant means it is cancerous. So when we talk about benign, basically these diseases are non-cancerous, so which means we can cure them. Some may need surgery, some may not. So those patients where we do not need surgery, which can be treated with medication, we call them conservative treatment. Malignant means cancerous, so which means anything that is appears to be cancerous needs urgent attention, meaning that you have a small lump, you're worried, you need to come as early as possible. And that one repeated thing which we see not only in breast cancer, in any type of cancer, is early detection improves your outcome. Basically, when we find the cancer, when we catch it at the early stage, okay, and we start treatment early, the outcome is always good. Okay, we can try to cure it to some extent. All right. So when we look at benign diseases, there are few diseases which you can see there: breast cyst, abscess, fibroadenomas, ductal papillomas, fat necrosis, mastitis, and mastalgia. I hope I didn't frighten you with all those names. Don't worry, we will go through one by one, right? And malignant cancers are ductal carcinoma in situ, invasive carcinoma, and inflammatory breast cancer. So we will go through this one by one. So first and foremost, breast cyst. Cyst simply means that there's a collection of fluid in any particular tissue. It can be your breast, it can be your liver, kidney. Okay, it doesn't is not that dangerous, but however you need to be investigated. So basically our cells sometimes they secrete, dia akan keluarkan air. Okay, so some of this fluid will be absorbed in the body, but sometimes this fluid cannot be absorbed. So what happens is dia takungan air dekat payudara. So this will appear as cyst. Sometimes small cysts we need to do anything, but nevertheless we will need to do an ultrasound or a mammogram to make sure there are no other features that looks dangerous. Okay, small cysts can be left alone. A very large cyst which can cause pain, or we are worried, we can do surgery for it to remove it, or we can just use a needle to aspirate the fluid out. All right. Next is breast abscess. Okay, breast abscess is not a cancerous condition. It's a very painful condition. So when we look at breast abscess, there are two types. One is lactation, one is non-lactation breast abscess. So sometimes mothers who breastfeed their children, they are prone for getting breast abscess. As you know, the baby or the newborn suckles on the breast, and sometimes these nipples may get cracked or may get infected, and because of that, they will get abscesses. So these abscesses can be very painful. The skin will look red like what you see there. The patient may have fever, and if they have diabetes or any other problem, this can progress very rapidly. So patients like this were advised to come as soon as possible so that we can do surgery to remove all that pus. Usually once the pus is out, patient is very well and they can go home. Non-patients without lactation, and they come who do not lactate and they come with breast abscesses, these are a little more of concern. Okay, so this one we need to examine more thoroughly. Why are they getting the breast abscess? Most commonly, what patient will be diabetes, or sometimes a very small tumor behind there, or patients who had some infection from some other places may develop abscesses. So usually a course of antibiotics with and without surgery will settle this problem, but nevertheless you will need to do a ultrasound or mammogram to confirm if there's nothing else behind that abscess. Okay. Next is fibroadenoma. Okay, so this one we may need to pay a little more attention. Okay, I don't know if you can see it clearly on your screen, but there's a small lump there behind just above the nipple. All right, so when we talk about fibroadenoma, these are basically, it's a form of tumor. All right, so what happens is our cells in the breast, okay, they become very sel dalam payudara lebih peka kepada hormon. Okay, hormon kaum wanita iaitu estrogen dan progesteron. So bila hormon ini during menses, dekat masa-masa dekat kitaran haid, hormon ni akan meningkat. So bila hormon ni meningkat, payudara, sel-sel dalam payudara akan lebih peka kepada hormon. So bila because of that kepekaan, all these cells will become replicated, they become bigger and they become more. So when they membesar, you will feel a small lump on your breast. All right. So very commonly we see them among patients between age 20 and 30, more in the younger age group, and it's because of the hormones, estrogen and progesterone. And of course, if you leave it behind, you don't do anything about it, there's about 2 to 3% of risk of malignant transformation, which means dia boleh tukar jadi cancer. So 2 to 3% means kalau kita ambil 100 orang dengan masalah fibroadenoma ini, 2 atau 3% pesakit yang tidak buat apa-apa, benjolan itu boleh tukar jadi cancer. So we always advise someone who comes with these small lumps, at least do an ultrasound, or we do a small, put a needle and we take some sample to make sure it is not cancerous. Next is we talk about ductal papilloma. So like I mentioned earlier, the breast consists of multiple lobules where the milk is produced, and it travels down those ducts and it ejected out of the nipple. So these are the ducts which you can see in yellow. So what happens, these are ducts. So ducts are basically like a hollow canals, like a straw, something like that. So what happens in these kind of papilloma, there are small growth which can occur in your ducts. Very small growth. Kadang-kadang mata pun tak nampak. Okay, so what happens when the growth grows inside those ducts, they start discharging some fluid. This fluid can be greenish fluid, can be reddish fluid, bloody or yellow, but no blue lah. Unfortunately, no blue fluid. There's only this kind of fluid. So what happens is, it can be very troublesome for the patient, for them to see blood coming out of the nipple. So it can be very distressing. But what's more important is they won't feel any lump there. So these papillomas are very small. They can't feel anything. So it's very distressing. So this also will need urgent attention, because these papillomas, most of the time they are benign, which means they're not cancerous, but a very small group of them can be cancerous. So that's why you need to come early so that we can check and find out what is the problem. If it is non-cancerous, the surgery is pretty much very simple surgery. Very small incision can be done to remove these papillomas. So like there's a picture there, you can see in red on your right hand side, just a small incision made. The papilloma is removed and we place some sutures for the wound to heal well. And papilloma ini kita akan hantar untuk makmal buat kajian untuk pastikan dia bukan jenis bahaya seperti cancer. Next is fat necrosis. Fat necrosis we see in patients who had undergone some trauma. Okay, sometimes seat belt injury, they develop this fat necrosis as a result of vigorous exercises or as a result of trauma. Okay, they develop a injury, and once the injury is there, it may get infected or that part of the tissue dies. As you can see there on your left hand side, it's all red and swollen. So we will need to do surgery to remove that dead necrotic part on your right hand side, and tissue ni akan similarly dihantar ke makmal untuk buat kajian. This is quite rare, more common in patients who are with diabetes as well. Next is mastitis. Mastitis means basically inflammation of the breast. Okay, so what happens is the entire breast or part of the breast becomes inflamed or infected. So when we look at mastitis, okay, there are various types. Okay, most of them can be treated with medication, except for the last one which you see there, inflammatory breast cancer, where surgery needs to be done. So lactational mastitis, like what I mentioned, those patients who are breastfeeding, okay, sometimes because of the repeated suckling and pain and those tissues get cracked, they may get infected and they may appear red like this. Patient will have pain, they will have fever. So sometimes before we do anything, we will give them a course of antibiotics, make sure the whole some anti-inflammatory drugs. Once everything is settled, patient will heal very well. If this lactational mastitis, nothing is done, the patient let it progress, it can progress to abscesses, which means pus in the breast, right? Like what you saw earlier. Second is granulomatous mastitis. There are some patients who come with chronic inflammation. Kenapa dia jadi, kita pun tak tahu. Some patients have more risk of developing this mastitis. So it's a very reoccurring and very troublesome, can be distressing, they can come in pain, redness, inflammation, and when we do biopsy, it doesn't show cancer. So when we give them some medication, they get better for a while and they keep coming. So this is another problem which we quite commonly see. Next is tuberculous mastitis. As you know, tuberculosis is still pretty much prevalent in our country. So a very small group of patients may come back with this tuberculous mastitis. And lastly, which needs urgent attention, is the inflammatory breast cancer. Once again, we will take some biopsies from various areas, some around here and here, few areas. We'll take some samples, and if the results come back as inflammatory breast cancer, patient will have to go for surgery. All right, what about mastalgia? Mastalgia means pain, algia means pain. So these patients won't have breast lump as such, okay, but they will come with recurrent breast pain. So bila kita tengok patient jenis ini, we can broadly divide them into two, cyclical and non-cyclical. So cyclical means kitaran. So most of the time we see patients with cyclical breast pain is because of their menses. Usually about 2 to 3 days before they get their menses, the hormones will surge up. It will go up and then it will come down. Okay, so during the initial period, okay, because of the hormones, and this breast tissue is very sensitive to these hormones, so they will develop pain. All right, so most of the time after the menses subsides, the pain will improve. So these patients, during the time, we can give them some medication. There are some hormone medication we can give to suppress the hormonal activity, or some patients may get some benefit in this thing called evening primrose oil. Okay, when they take this, it sort of like gives them some amount of pain relief. Non-cyclical is what we need to investigate. Sometimes patient will have this kind of pain. Most of the time is because of some nerve injury or nerve pain, some muscular pain, some joint pain in around the area of the breast. They may come with the pain which is radiating to the breast. So the treatment for this depends whether they are cyclical or non-cyclical, but most of the time they don't need surgery for this type of patients. All right, so now we go into the bigger heading of breast cancer. So in a nutshell, in a way of simply putting it, cancer basically talking about cells which grow uncontrollably and grow fast. Our body have got systems to keep our cells to grow in a very controlled manner. But these cancer cells, okay, once you develop it, they grow out of hand and they start off as a lump. So once it grows bigger and bigger and the body is not able to contain it, it starts spreading to surrounding tissues and organs. So from the breast, it can go to your armpits. In your armpits, you have lymph nodes. It can move there. It can go spread, to distant organs such as your bones, brains, lungs, okay, and your liver. All right. So that is why we try to catch this. We try to get them as early as possible before they even spread to the lymph nodes. So this is how the picture of early cancer look like. You can see the cells in beige, which are the normal cells, and the cells in the blue, which are the cancer cells. So when they start growing uncontrollably, okay, there's no order to it. It starts going in all direction, atas, bawah, tepi, depan, belakang, so it just moves all over. All right, so when we talk about cancer, first thing you want to know is who are at risk of getting cancer. So when we talk about breast cancer, we simply divide them into non-modifiable risk and modifiable risk. So non-modifiable means you already have it, those risks which you cannot change, and modifiable risk, the risk which you can change. We will go into detail one by one. All right. So first and foremost, gender. Yes, females, it's a non-modifiable risk because if you are a female, there is you already are at risk of developing breast cancer. You can't change that. Next is age. A higher age group, the older you get, the more risky you are to get. And patients who are in their menstrual age, basically the entire period where you are menstruating, that is the highest risk in which you can get breast cancer. Next is menstrual history. So basically, the earlier you get your first menses and the longer period you have your menses, the more riskier you are in getting breast cancer. So like I mentioned, breast cancer, these cells are as a result of the estrogen and progesterone hormone. These are what we call the female hormones. All right. So the longer you have these hormones in your body, that is during your menstrual period, the entire period where you have your menses, this is where you are at higher risk of developing breast cancer. Next, we look at breast density. The more dense the breast, that means the more thicker your breast tissue, the higher risk of you getting breast cancer. Next, we look at personal history of breast cancer. So how is that possible? Okay, when someone gets breast cancer in one breast, like ladies, they have two breasts, right and left. So when they develop breast cancer in one side, they are at risk of developing breast cancer on the opposite side. All right, so they can get it a second time. So these patients, we need to really look very closely. And lastly, we talk about family history. You can't change that. So if you have family who has got breast cancer, you are definitely at risk. So I'll just talk a little bit more deeper with regards to family history. Okay, for example, person A, okay, she's a lady, her mother has got breast cancer. So that means she is at risk of getting breast cancer. all right? But if that same person A, her father's mother has got breast cancer, so she doesn't have any risk. So basically what I'm trying to say is your maternal side. If your mother's side has got breast cancer, you are at risk of getting breast cancer, all right? So what about, okay, let's say the mother doesn't have breast cancer, but person A, her sister has breast cancer. Okay, so once again, you are at risk. But when we look at the risk between a mother and daughter and a sister and sister has got more risk to develop breast cancer when we compare mother and daughter as well as sister and sister. All right, so if you have any close family members who have got breast cancer, especially on your mother's side, you must take this seriously and you must go and check from time to time. How about non-modifiable risk? So basically, this is the risk is what you are in control of. So basically, you can control these risk factors. So diet, there are studies to show that a very high fat diet, a very fatty diet, high protein diet, okay, has got a slight risk of developing breast cancer. Patients who smoke have got risk of getting breast cancer, and those who are also taking alcohol, all right? There are some small studies which show that patients who are obese will have a risk of getting breast cancer. However, this is still very small. There are more studies we are looking into it, and but whatever it is, you are advised to keep an eye on your weight. Lifestyle, of course, those who are very active lifestyle, you know, type A personality, a lot of stress, you know, and because of that, you're not able to eat well, a lot of unhealthy food. So you're advised to keep an eye on that. Nulliparity. So parity means how many times you get pregnant. All right. So nullipary means you have never gotten pregnant, and multipary you have gotten pregnant before. So patients who have never gotten pregnant, all right, you are at risk of getting breast cancer. Patients who use hormonal contraception, okay, as you know, contraception uses progesterone and estrogen, okay. So when you take these contraception, your body is at risk at secreting these extra hormones, and then you will put yourself at risk at getting breast cancer. Breastfeeding is seen to be protective. Basically, if you've had baby before, you have breastfed, it is considered a protective mechanism against breast cancer. So these are the risk factors which you can modify and to change it, you know, to put yourself less at risk. Because when you look at this one you can't do anything about, it's already there. But one thing which you can change is the modifiable risk. Okay, so please take note of this, and then keep track of your lifestyle, the medications you take, and your habits. Signs of breast cancer, I think there are a lot of talks, a lot of awareness which has gone through. So I'm sure many of you are aware of it, but we'll just go through very simply. First of all, if you have a lump, you have to come forward. Pull in nipple or nipple retraction as we call it, dimpling on your breast, anything dripping out of your breast, okay, like a nipple discharge, bloody nipple discharge, or pus or something, you need to come back. Or if you see any skin changes, any sort of rash, you know, or skin peeling or redness, you have to come to get yourself checked. So we'll go through one by one. Similar picture just now, you see a lump below that. If you see a lump like that, please do come and see us early. Okay, this is how nipple retraction look like. The nipple has gone inwards. But just to take note, nipple retraction, there are some people who are born with nipple retraction, so that is fine, all right? But those who have been fine, they have normal nipples, but over the last 1 or 2 months or 3 months, they found that their nipple have retracted inwards. So that change is important. So when you see these sudden changes, these new changes of nipple retraction, this is what should alarm you, and you have to come to get it checked. So when I talk about dimpling, this is what I meant. It's like we call it a peau d'orange. Basically, it's like an orange skin. You see all those dimpling on the skin. So this is what it looks like. Why does it occur? Okay, so below the skin there are cancer cells. The tumor cancer is growing. So what happens is it gets stuck to your tissues around your cancer, and it pulls it down. So when it pulls it down, that is where you get all those dimpling. So this is another sign that you should look out for. Next is nipple discharge. You can see it can be quite distressing. The skin can be excoriated. There may be an ulcer. So when you have nipple discharge, also your advised to come early. All right, so identifying and self examination. So uh, many doctors or many healthcare workers will tell you to examine very regularly. I think in our Fatima Hospital Facebook page, there are a lot of videos and a lot of pictures showing you. You can go through them, but just as a brief guide, okay, you have to stand, you get yourself in front of a mirror, get a nice big mirror where you can see both breasts equally. All right, and then you start your examination from clockwise fashion using the flat of your hand, and you check all the areas, okay, and carefully looking for those lumps, retraction or skin changes. All right, and once that is done, you don't find anything, then you move on to the other breast. All right, next is, if you do find something, or even if you don't, okay, you are advised to go for ultrasound or mammogram. So nowadays the cutoff age is 35 years. So once 35 above, you are advised. All right, because sometimes someone with a very large or dense breast, okay, they may have a small lump which is situated at the back, like what you see in that picture there, the one which I've circled in yellow, these parts. So you may not able to feel it, okay, but through the mammogram you can see it very clearly. So that's why you're advised to go early, okay. But by the time this lump which you see there in that picture gets bigger, it may be a little too late. So that's why we advise you to go for yearly, or if not 2 yearly ultrasound or mammogram. So this is how an ultrasound looks like. It's a very good tool to use. It's not painful. It's quite easy. Almost anyone can do it. All right. So you just use some gel, put the probe, and from the scan is very easily detected. And another good thing is, when you see that thing there, we can do a needle biopsy immediately at the same sitting. So this is what I mean, needle biopsy. You can see there, we use a small syringe and needle. We will feel that lump from the outside, and then we will insert that needle, and we will just take a little bit of tissue from there. Sometimes kadang-kadang tissue ni mata pun tak nampak. Okay, so kita akan masukkan dan check dan bawah mikroskop untuk apa jenis benjolan itu. It's a very simple procedure. You don't need to be admitted. You can do it in the clinic. I wouldn't say there's no pain. Everything we do, there's slight pain, but it's very minimal. It's just like taking blood, something like that. All right. So now we know. Okay. So these are how we detect. What does it look like? So what are the treatments? Okay. First and foremost, the main treatment will be surgery. Okay. Selagi cancer itu ada sana, dia akan membesar dan akan menjadi risiko. So it's always best to remove the breast. So breast surgery, we will say, we call it as mastectomy, which means removal of the entire breast. Or nowadays what we can do is we can remove just part of the breast. Whichever the lump is, we can try to remove it. The second important thing is we need to remove the lumps. Okay, breast cancer, the first place is going to spread is into your axilla, into your lymph nodes, your armpits. So we need to do a surgery during the same time to remove all the lumps. So once we remove these lumps, we will send it for the pathologist, the lab, to check whether there are cancer cells which are spread over there. And this will help us to decide whether we need further treatment. Kalau lymph node, limpa tak ada cancer, which means good, okay, it's the early stage. If there are cancer cells in the lymph nodes, then we go on to number 2, which is chemotherapy. Alright, there are many taboos. Kebanyakan pesakit risau bila dengar nama ni chemotherapy. Actually, yes, it is a bit scary, for you to undergo this chemotherapy. So basically, these are drugs which are given through your veins, and these drugs will go in your body and try to kill all the cancer cells. Because when we remove the breast tissue or the cancer cells, we remove what we can see. Apa yang mata nampak kita boleh keluarkan, tapi apa yang mata tak nampak, macam anak-anak cancer atau sel yang tertinggal, we will rely on chemotherapy and radiotherapy to kill them. So that is why it's important for a patient to go for this treatment. If you do surgery, is good. Combined with chemotherapy, even better. Combined with radiotherapy, even better. All right. So your surgeon and your oncologist will decide which form of treatment is the best for you. All right. And lastly, once all the treatment is done, sample tissue akan dihantar untuk dikaji sama ada cancer ni boleh respond kepada ubat hormon. So we will put you on hormones for 5, 7 or 10 years to make sure your other breast, okay, doesn't develop cancer. So these are the usual routine treatment which we do for patients with breast cancer. So what happens when we don't do anything? Okay, when you know you have a lump, you don't come forward, you're a bit scared. The prognosis means how well we can treat it and how bad the cancer will go. The prognosis gets worse and our treatment option is limited. So like I mentioned before, if you develop breast cancer, it can spread to the opposite side. It can spread to the liver, lungs, bones and brains. So when a cancer is left untreated, okay, this is what it looks like. Kanser tu membesar sampai kulit pun pecah, boleh bernanah dan boleh berdarah. This is another picture on how it looks like. But because by the time it comes to this stage, our treatment is limited. Kalau nak buat pembedahan pun susah. Okay, because it would have stuck to the muscle behind, it may stuck to the bone, so it'll be very difficult for us to do surgery. We have had patients who come with very large tumors like this. Kalau sudah ke tahap macam ni, there's not much we can do. Probably we can give some chemotherapy, some radiotherapy, but untuk mengubati sepenuhnya memang memang susah, right? So other problems which can involve is, can you see the first picture with the two ladies? When the cancer spreads to your lymph nodes, to your armpits, the blood flow and the fluid flow in your arm will get disrupted. So tangan akan menjadi bengkak. So bila tangan menjadi bengkak, senang dapat kuman dan masalah dan sebagainya. Next is the picture on the right. You can see all those white spots over there. This is where it spreads to the bone. Dekat sini, sini, sini dan sebagainya. So we will do a certain type of scan to check whether it has spread to the bones. Your cancer can spread to your brain. So when we do a scan, this is how it looks like. Cancer dekat sini dan dekat sini, sini. So patient dengan cancer yang sudah merebak ke otak, dia akan sentiasa ada sakit kepala, dia boleh ada sawan, mata penglihatan akan kurang dan sebagainya. And patients who have spread to the bone, they will have very bad bone pain. They may have nerve problem, they may have fractures, so it's a very long and very painful process. Those who are spread to the liver and the abdomen, perut tu akan jadi kembung dan akan ada takungan air di dalam itu. So from time to time, the patient have to come and we will put a needle to remove all the fluid from here. And lastly, patients also can have fluid collection in the lung. So dari masa ke semasa, patient akan datang dan kita akan keluarkan air untuk dia, patient lebih lega. Alright, so this is my last slide. So basically what I want to say is, if I can create this awareness, is that any lumps, however small it may be, it's always best to get it tested. Alright, so like what I mentioned just now, you can do a mammogram, you can do an ultrasound, or if you're really worried, we can do some tissue sampling to make sure that it's safe. And then always, when you come early, our treatment options are more. Your surgeon, your oncologist, okay, your nurses, we can do more for you. And of course, we can offer a complete cure if the cancer is not that aggressive. We have seen patients who have had cancer and they are well over their 20 years mark, 30 years mark. They are very well, provided we catch them early. All right, and of course, once you have diagnosed with cancer, a combination of therapy is important. Basically, some will just say, oh, doktor tak apa cukup lah, operate saja cukup. Tak perlu chemo, tak perlu radio. Actually, it shouldn't be like that. You should discuss with your oncologist and your surgeon. Surgery, when you combine it with other treatment, the outcome is always better. And lastly, I'd like to introduce you to this term called triple assessment. So basically, you have a history of lump. You need to get it checked by yourself. Okay, how bad is the lump? Is it very big? Is it very hard, painful? And you need to combine it with ultrasound or mammogram, as well as a tissue sampling. So with that, I thank you all for your attention, and I hope this talk has been beneficial, and hope you can take this message and carry out and pass it to your friends and families. Thank you.
Okay, thank you, Dr. Mark, for this very informative talk. So, okay, Dr. Mark, we will have our Q&A session now. Okay, let's start with our first questions from the audience.
Okay.
Okay, this questions comes from Mina. Hi, Dr. Mark. Does breastfeeding really reduce the risk of breast cancer?
Okay, when we look at it in a theory point of view, that means we look at all the studies, we look at research and all that, it does offer a risk reduction for breast cancer. However, we still find patients who have breast fat and they still come in with breast cancer. So then we have to look at other aspects. So whether they themselves have a family history of breast cancer or whether they are genetically predisposed to breast cancer, which means that they in their own genetics they have a higher risk of getting breast cancer. So we have to look into all these things as well. But in general, yes, breastfeeding does reduce your risk of getting breast cancer.
I see. Okay, doctor. We go to the next question. She also asked another question. How to differentiate between muscle spasm and a lump when we do self-breast examination?
Okay. Okay, this is quite a common question which we get. It's very significant. All right, a lump you will feel it very clearly. It what people usually comment it as a, and we compare it with a coin, 20-cent coin or 30-cent coin, and it can occur anywhere, and it's usually very rounded. It's very clear, and it can move about in the initial phase. Muscle spasm or muscle lumps is usually very deep, and when the muscle spasm is more during movement, all right. But for the breast lump, when you check during any time of the day, when you're at rest or during your bathing or during any time, it will always be there, all right. So it's pretty clear cut, all right. And muscle is usually movement and it's deep seated, all right. Another thing is patients do come with this thing called lumpy breast. That means their breast is very padat, very dense. So these patients also actually their breast is normal, but because they are so padat, they feel like there's a lump over there. All right. So these patients need to come early. But once again, if you're unsure, you feel you're not sure if it's a muscle spasm or lump, always come and see your closest doctor
Okay,
for
I see.
detailed check.
Okay, doctor. So we go to the next question. This from Dina Lim Ailing. Hi, doctor. Can lymph node swelling be a sign of breast cancer? Can it become cancerous if left alone?
Yes. Okay. Hi, Dina. Yes, a very good question as well. Okay, lymph nodes, as you know, it's in your armpits, okay, bahagian ketiak. So sometimes breast cancer patient, it will spread to your ketiak and you will feel a lymph node. But if someone who has a lymph node, but when they check their breast, they don't feel any lump, yes, it must go for checkup because a deep breast lump, which you cannot feel, may be a cancer which is growing there. Number one. Number two is some we notice ladies who like to shave their armpits. Okay, ladies who like to shave, their when you shave, your skin may look normal, but what actually happens, your the top layer of your skin will be shaved off as well. So there are very increased chance of infection which can go through. So when infection goes through there, sometimes you may have some lymph nodes which are swollen. So it may or may not be. But once again, if you're not sure, please come to see us. Or some patients with infection, okay, they can get very often they can get infection in their armpit. Okay, so these patients they can have lymph nodes, but may or may not be related to breast cancer.
I see. Okay, doctor. So we go to the next question from Nina. Doctor, does chicken hormones have an effect on cancer cells?
Yeah, okay. This quite a controversial question. So chicken hormone, I think you're trying to say that those hormones which are injected to chicken to make them grow faster. All right. So I think there are a lot of studies a lot of controversial studies, a lot of debates which goes on into this. There are studies which say yes, there are studies which says no. But then again, anything which you use other than for its normal purpose will always have a bad effect. All right, it cannot be proven yet, but it's best to be cautious when you are dealing with these kind of things lah. Another thing which we find is soya bean. There are a lot of people who say that, oh, when you take a lot of soya, because soya contains a lot of estrogen, the female hormone, So when you take a lot of soya bean, tofu, things like that, you may get cancer. Okay, so a lot of research was done initially. They said yes, but over time, newer studies show that actually it is safe. It is not really. But with regards to this chicken hormone, it is still controversial. Um, I can't really answer it. Nanti itu company ayam akan cari saya. So I think I'll just if we can avoid lah. If not, then probably just have to be careful.
Okay, Doctor. Actually, before we go to the next question, this is actually questions from me. I just want to ask you about deodorant. Is it true that if you're like, it's what is different deodorant and antiperspirant? No, got two. They said it can give the risk of getting breast cancer.
No, actually, the risk is there's no risk of getting breast cancer unless they are very because nowadays the contents, the things which they put inside are usually very safe. They're usually tested, so it's actually quite safe. It doesn't cause any risk of breast cancer.
I see. Okay, Doctor. Thank you. So for the next question from Nur Faizul Nawawi. Hello, Doctor. Nak tanya apa perlu dilakukan oleh pesakit early stage after treatment untuk pastikan supaya sels hilang atau tak aktif?
Okay, that's a good question, Faisal. So kalau ikutkan secara percentage, kalau dapat kanser di peringkat awal, memang risiko sangat rendah. Tetapi basically when you go back to the modifiable risk lah, pastikan tidak merokok, makan makanan yang seimbang, dan yang penting ialah jika seseorang yang sudah ada kanser payudara, penting ialah cek payudara sebelah lagi regularly. That is more important than maintaining a normal and healthy lifestyle, and go for your regular ultrasound or mammogram. Itu yang lebih penting lah jika seseorang sudah ada kanser. Sometimes peringkat awal doktor oncologist akan suruh makan ubat hormon. So make sure you are on that supaya risiko akan lebih rendah kepada payudara yang masih ada lagi.
I see. Okay, Doctor. It seems that there is no more questions from the audience. Okay, then if there's no more question, we will wrap up this session. Okay, thank you, Dr. Mark. Okay, and I'm sure you have all enjoyed this very informative talk. Thank you for watching. We have now come to an end for this talk, but nevertheless, not the end of our activities. As we invite you to further join us in another Facebook Live talk. Please follow and like our Instagram and Facebook for more information. Thank you, keep safe and stay healthy. Have a good day, everyone.
Thank you, everyone. See you all.